Keeping our feet healthy is so important for our overall health and mobility, and we really need to pay special attention to any wounds or injuries on our feet, as they can take a while to heal. Here with some advice is Dr. Trevor Haynes and Dr. Daniel McManus with Elite Foot and Ankle Associates. Hi there, welcome.
Thank you.
Okay, so tell us, you have several offices around town, but you also have a home wound care program. Tell us about that.
Yeah, so we saw a need a couple years ago where we were seeing a lot of patients and getting a lot of calls to our clinics where patients were requesting more care and they were unable to get into the office. So we started to build this program about getting out to the homes and treating these complex wounds that patients have.
And what kinds of patients benefit from this?
So any patient with a wound, I mean, with us being podiatrists, our focus is mainly foot and lower extremity, but we have a nurse practitioner that does a lot of this, and so she'll focus a lot on any sort of wound, right? So they could be sacral wounds, they could be back wounds, any sort of wound out there, but our main target is typically lower extremity.
Yeah, and you know, I visited you at your office in Sandy before, and we talked about a skin graft type thing. And tell us about that and why it's especially important for a lot of your patients who might be bedridden.
Yeah, so these skin substitutes, they're grafts that are taken from placentas, right? And they will speed up healing. So what we can do is we take these grafts, we're able to take them to the home, apply them to the patient, where they're typically not getting, I don't want to say the proper wound care, they're mainly getting bandage changes, but we can take these grafts, apply them, and help hopefully speed up that healing time and get these chronic wounds healed up.
Got it. So who qualifies for home visits, and how would a person get started?
So patients that are unable to get to the clinic for whatever reason, maybe they're bedridden or maybe they have transportation issues, if something like that is going on where they can't come to us, then that's why this is a great service, because we can go to them.
Yeah, that is great. Does insurance typically cover this? Medicare? How does that work?
Yeah, typically if they have one of those reasons for, transportation issue, bedridden, whatever have you, where they can't come to us, then typically insurances will cover it, and, especially Medicare.
Understood, just as long as there's a reason, as
you
say.
Yeah.
What are some more benefits of home care versus making the trip into the office?
Yeah, so it's just easier for us to go to them versus, some people unfortunately may be wheelchair bound, they may be morbidly obese, and it's difficult for those types of patients to come into the clinic and get their wounds treated. Sometimes even ones that are bedbound, it's easier to treat them at home on their bed versus come and sit in our podiatry chair and figure out how to treat these wounds. So it's just easier for us to go to them versus the difficulty of them finding that transportation and just getting out of their facility or their home to get into our offices.
Sure, those stress levels really go down if they don't have to make that trip into the office, it sounds like.
Correct.
Tell us more about your office and your practice and the other things you offer, the other services you offer.
Yeah, so we're kind of a one-stop shop type podiatry practice. We try to offer everything we can. I mean, we do surgery, we do conservative measures. Wound care is a big focus of our clinic. So we have multiple offices all across the Portland area. So you can definitely come in, we can treat your wounds, we can treat whatever foot, lower extremity pathology you have, but obviously this is a benefit that we offer to be able to go to your home as well.
Yeah, and how do patients react when you tell them, don't worry about it, we can come to you, and they do? I'm sure there's a little relief there sometimes.
There's been times in the clinic where patients will say to me, is that a service that you guys provide, because for whatever reason it's really difficult for them. Sometimes it's their entire day is planned around going to our clinic. So when they find out that, oh, we can go to them, they ask about it. I'm like, yeah, absolutely, we can schedule to come out to you.
Yeah.
And they just absolutely love it.
Yeah, great. Okay, well, how can people find you and schedule an appointment?
Yeah, so they can give us a phone call, 503-668-5210, or they can reach out at our website at elitefaor.com.
There it is on your screen. Thank you so much for being here. Really appreciate it.
Thank you for having us.